think it's really important not to overreact. Definitely don't ignore or don't follow up. Sometimes I think parents will, or really any adult that gets that information, kind of freezes and hopes that their next action won't do any harm. And so sometimes that's avoidance or ignoring, and that's not the appropriate thing to do. What is appropriate is to validate what they're saying, really encourage them, and say how hard it was to even bring this up, to really talk about their courage and how much you appreciate that they brought this up, how hard that would be. It's a really hard topic to talk about. So really validating those things for them first to really put them at ease and let them know it was a good decision to talk about it. The next step is really working to not overreact. Let them know, that the fact that they told you this really helps their safety. It helps maybe if it's a friend of theirs, it helps keep them safe, and that it's not sounding the alarm and the police are coming, and letting them know what that looks like, what the reaction is going to look like, that it's not something dramatic necessarily or really severe, but that it's something you want to work with them together to figure out what the next best step is, whether it's for them or their friend. But really, like I said, being calm, being validating, asking questions, seeming curious, wanting to know more, so that you can really understand the situation and the feelings that they're talking about. And then working with them together on what the next best step would be, whether that's we need to keep you safe, pulling in a therapist possibly, giving them some coping skills, whether if the need is severe, whether that means we do have to look at possibly a higher level of care, how you're going to do that with them, but just being really supportive and collaborative of looking at options. So again, I think really validating to their child how difficult that decision was for them to basically tell their friend's secret, or to kind of maybe even breach that trust, that they saw the bigger picture, which is they care for their friend and they want to keep them safe, and how important and difficult that decision was. Because a lot of times that's what teenagers really are concerned about, is maintaining loyalty in the friendship, and is that person going to be upset with me if I tell? And that's a really hard decision at any age, to say, well, I'm going to put that aside and look at the person's safety because I care about them, and make the difficult decision to talk to somebody about it. So really making sure that you let your child know that you get that that was a hard decision, but that ultimately the reason that they made that decision was because they care about them and want to make them safe. And so we have to do something. We have to do something together, whether that's contacting the other person's parents, contacting the peer themselves, and having a conversation with that peer, maybe with your child and you present, and then pulling in the other parent. So there's a lot of options, but I wouldn't recommend telling the child we're going to keep this a secret or we're going to keep this to ourselves, because ultimately you did this out of care and concern for their safety. So let's follow that through with some action. So really what you look at is kind of a drastic change, whether that's in their mood or their personality. A lot of times people see the picture of suicidality as, they seem down all the time, or they seem irritated or angry all the time, or they're disconnected. And those are things that you want to look for. But the opposite can actually also be true, and that if you typically have a teenager who is very kind of neutral, typically, and they seem very excited and very positive, that's also something you want to look at. That's surprising to a lot of people. Why would you be concerned if someone's very happy? Well, if it's outside of their norm and their baseline, and it's a drastic change in either direction, that's something you want to look into. What has caused this drastic change in mood or behavior? This is somebody who wanted to go to parties and was very active, or very active in their in an athletic life or academic, and all of a sudden doesn't want to take the keys to go drive their friends around, or doesn't want to go to the parties. That's a change. Or perhaps this is someone who really isolated and now all of a sudden is hanging out with a different crowd, possibly bad influence, peers, those types of things. You want to look at really any drastic changes and talk with your child. You know, they may not be as expressive as you would like, but continuing to check in, asking what's going on in their lives about the different facets, socially, academically, and continuing to really look at that. And if they're not talking with you, letting them know, hey, I know you, I love you, and I'm concerned about you, and I feel like things are changing, and I want you to have a place to talk about that if it's not going to be me, and pulling in a therapist at that point to give them a really objective, safe person that they can talk with these things about. Knowing what you're allowing your kids to watch and reading about the series, reading about the topics and the scenes that are in them, and understanding if it's age appropriate first. If your child is of age to watch that, then the next step is really looking at your child and their risk factors. If your child is someone who has struggled with mood difficulties or past suicidal thoughts or depression, or is particularly sensitive to those types of topics, or even dealing with it on their own, it's not something I recommend them watching. They're particularly vulnerable, and it's not something that you really want to expose them to deepen those emotions for them, or perhaps heighten those emotions for them. There is a very popular thought about something called suicide contagion. And, you know, I think while there is a particular need to be very careful about how we talk about those that have completed suicide, we don't need to romanticize it. We don't need to necessarily paint a picture that is romanticized in a way of the death. However, it's really important that people realize that a common myth that people think is, if someone is not suicidal, or even if they've had suicidal thoughts or are currently suicidal, you don't ask about it. Now, that's a myth. It is important that you are talking about and assessing for suicide if you suspect it, or really even if you're just working with the child, doing frequent check-ins. It's not going to give people the thought of suicide or push them over the edge to do it. There's a really important study, it's Gold 2005, that looked at whether or not asking about suicide increased distress, increased depression levels, increased suicidal ideation, and it found that asking about suicide actually did not increase those things. It happened to decrease it. If you are depressed and you're suicidal and someone's asking you about that, you're actually going to feel some distress relief, because someone's talking about something very difficult and sharing that with you and giving you support and maybe even giving you options for how to handle it. So distress levels actually went down in that study. So I think a lot of people feel like if I ask about it or if I say the word suicide, it's going to implant that idea, or it's going to push them over the edge and I should stay away from it. And it's really the opposite that's true. You do want to ask about it and talk about it and make it a topic of discussion, and not be fearful of doing that.